Greetings, people. My name is Ira. I call myself South France American because that's the title of my blog, SouthFranceAmerican, all one word.com. So I talk about a lot of stuff in my blog and in more detail than I do in these short videos. So go on over and check out SouthFranceAmerican.com. Of course, if you enjoyed this video, please like and subscribe to my channel. This video is about French healthcare, specifically about how French healthcare worked when my wife was diagnosed with breast cancer. And a couple of spoilers right away. Kathy is fine. We're into our second year after the operation, and she's cancer-free and expects to remain so. Second spoiler is, didn't cost us hardly anything at all, a few euros here and there. But basically, French healthcare, the public system, comparable to Medicare, that generally pays about 75% of your medical bills, plus our supplemental insurance, what we call in France our mutuelle, picked up the rest almost entirely. So not only was the healthcare itself what I consider to be A1, but the cost was appropriate given our levels of insurance. Now, we are on the French healthcare system. We've been here for 7 years. We applied for the French system when we became eligible. And we can talk about how the French pay for their healthcare in another video. But we're on the healthcare system, and that allows a woman to have a mammogram every 2 years. And sometime in late August or early September, Kathy and I haven't gone back to our calendars, but that's when we think it happened. Sometime in late August or early September, a couple of years ago, Kathy went in for her biannual, every 2 years, free mammogram. There's a imaging center in Béziers that we go to. And we were waiting for the results of the mammogram, because what happens is that the people take the mammogram, they read the mammogram, they write up the report, and while you're in the waiting room, they're doing that, and they give you the report and they give you the pictures before you leave the imaging center. That's how French healthcare generally works. You are responsible for your own medical records, and you have control of them. You have them in your hand. It's called your dossier. And so the next time you go to the imaging center or the doctor, you can carry your dossier with you. So we were waiting for the report to come out when one of the nurses came out and said, we found something on the mammogram. We would like to do a sonogram to confirm. So Kathy went in, had the sonogram, and then a doctor came out, took us into the offices. And I'm talking about us and we because I generally do go with Kathy. She's certainly capable of going herself, but I have better French, so it's generally easier for me to interact with the doctors, nurses, and other staff. So we go into the office, and he shows us on a computer screen this little dot that they're concerned about, and they want to have a biopsy done. And it will be done in the same facility. It'll need to be scheduled. A couple of weeks, we come back, they do a biopsy. A little while later, after the lab reports come back, we get called to come back again to the facility. We go back to the facility, and we are told that the biopsy showed us malignant, and there would have to be an operation. And we were referred to a surgeon. The surgeon was a Dr. Ondidieu, and he had offices also in Béziers, and the appointment was scheduled for a couple of weeks. In the meantime, we met a couple of women, or we knew a couple of women who had breast cancer, and we started talking to them, and we discovered that Dr. Ondidieu was indeed their surgeon as well. They liked him, so we felt comfortable with the referral, and we went to see Dr. Ondidieu. Turns out he had trained and practiced for a while in the United States and Canada, so he had very good English. And the first thing he asked was, did we want to have the procedure done in the United States? And we both kind of laughed. I mean, it made sense to ask the question because we were Americans and might not feel comfortable in the French healthcare system, but as a matter of fact, we feel much more comfortable in the French healthcare system than we do in the American. So we said, no, we want to have it here in France. Again, scheduled for a couple of weeks after that. Kathy and I and her sisters went to the hospital. We wished her well. She went to the operating room. She came out. And the nurses said that the doctor felt very comfortable, that things had gone well. She was a little woozy. We said goodbye. She spent the night. The food is just as bad in French hospitals as it is in American hospitals. Unfortunately, Kathy didn't spend a really pleasant night because the Clinic Champeau, is in downtown Béziers. Across the alley was an apartment building, and a couple was having a knockdown, drag out, break the dishes domestic row, and so Kathy didn't get a lot of sleep. But we brought her home, and she was fine. Every couple of days, the nurses came to the house to check and change the dressing. We did, however, get a call from the surgeon. There's a problem. In checking out the flesh that we excised, kind of a lumpectomy, we did discover that there were some abnormal cells around the flesh. And so we would like to go in again and just scrape around the edges to make sure that we got all the abnormal cells. I should point out at this point that the type of cancer that Kathy had was not a lump, and it was not a lumpectomy. It was sort of a threadectomy. 5% of breast cancers, we were told, are these sorts of threads or filaments and not lumps. And that makes them very difficult to detect and often a bit more fatal than lumps, because manual examinations will not detect these threads or fibers that make up 5% of breast cancers. Kathy's was very small, just a few millimeters long, so she caught it very early and it was easy to excise, but they did ask for a second shot at sort of scraping the edges of the incision so that all of the abnormal cells could be taken out. And we said, sure, I mean, if you have to do that, you have to do that. When do you want to do it? And they gave us a date, and unfortunately the date fell during a time when we decided to take a little vacation. And we told the doctor that, and the doctor said, oh, no, we don't want you to postpone your vacation, which is typically French. When I had my kidney stone removed, the MRI that confirmed that I had a kidney stone was read at noon. And the doctor came and said, okay, you've got a kidney stone. We're going to take it out tomorrow. We're going to put you in the hospital overnight tonight, but go home first and have a good meal before you come back to the hospital. Typically French, worried that you get a good meal before you have your medical treatment. And this was the way it was with this doctor, this OBGYN surgeon, who said, no, we want you to have your vacation. We'll schedule the surgery for before the vacation, and the nurses will take care of your bandaging so that when you leave, you won't have to worry about that. It'll all be over. And that's what happened. Quick in and out. It was actually day surgery. They cleaned things up, a few changes of dressing, and we went off on our vacation. We came back, and it was time for Kathy to schedule her radiation therapy. No chemotherapy, but radiation therapy. And that occurred in a different building, what's called Oncodoc, with a different doctor, a female by the name of Salas, I think. And so we went there. And the first thing we learned was that Oncodoc had a lot of different facilities besides the chemotherapy and radiation therapy. We sat down and talked with a nurse who said that she would be available without an appointment anytime we walked in, if she had any kind of problem. She didn't have to have an appointment with the doctor. If there was a problem that the nurse could take care of, she'd take care of it without an appointment. They also had yoga classes in the building. They also had a masseuse in the building. And they also had a psychiatrist in the building. So if there's anything you needed, they could take care of it for you. Tremendous care about not just the physical health of the patient, but the mental health of the patient as well. So Kathy was scheduled for about 12.5 radiation treatments. And they started right around Thanksgiving, and there were a couple of glitches. This time the machine didn't work. That time there was a power outage. So it took us from about Thanksgiving to about New Year's before the 18 courses of radiation were taken care of. Because you're not supposed to drive after you've had a radiation treatment, now I drove Kathy back and forth, but one of the other things that you can have in France is a free taxi. They had a hotline to all the taxi companies, and you were entitled to, under French healthcare, a free taxi ride to and from your house if you were having radiation therapy. I was one of the few people that actually accompanied the woman who was having radiation treatments. Most everybody took advantage of the taxi option, and that's kind of typical of the French. They'll take care, they will use the options that are available to them. And we spoke to one of the doctors about that, and what he said was that that's typically French. They do what they wanted. They do what they're entitled to do. Oh, I just touched the thing, and I'm sorry that the video bounced. Now, after the radiation treatment, Kathy had to take hormone suppression therapy, and there are several drugs, and she was given a drug, and one of the possible side effects of that drug is inflammation of the joints. And Kathy has terrible arthritis, so that inflammation of the joints became very painful. So we went back and we told the doctor that, and the doctor says, okay, we'll take a few days, clean that out of your system, and then we'll try the second drug. And that had the same effect. Meanwhile, Kathy had gone to an osteopath and had gone to an acupuncturist and her family doctor to talk about ways to deal with this problem of arthritis and the pain that the medication was causing. And she did all of that stuff, and still, the second medication caused the arthritis, and we cleansed the system again and tried a third, and the third medication caused a flare-up in the arthritis. So we ended up speaking with one of the doctors who said, look, this was a very small cancer that was easily excised. We believe that there is very little chance that it will recur, but if it does, we're going to continue to monitor you. You have to decide. We can't make a recommendation, but one of the options certainly is to simply stop taking the medication and being careful to monitor that the cancer doesn't return. Because at this point, it may be that the pain that you're experiencing is greater than your fear of a recurring cancer. And that was indeed what was the case. And Kathy decided not to take any more of the hormone suppression therapy. The joint inflammation went away to the extent that it was caused by the medication. And as I say, it's been a couple of years now, and she's been, every 6 months, she sees either the OBGYN surgeon or the doctor at the radiation center, and so far, so good. So we feel very comfortable about the manner in which the breast cancer that Kathy had was treated. We feel very happy, obviously, that she is cancer-free, and we are very pleased with the French healthcare system, which I will describe in a further video. Hope you've enjoyed this. Hope it's been, to some extent, a video that helps you understand how the French deal with things. Understand that from late August, early September to the end of the new year, the end of December, just 3 months or so, maybe 4 months, from the time the cancer was first diagnosed to the time radiation therapy was done, 4 months, socialized medicine. So if socialized medicine is done properly, if it is properly funded, and there are proper facilities for it, that this whole business of, socialized medicine, you have to wait years and years, is just not true. Socialized medicine takes care of patients, at least in France, and we're very pleased that it does. If you've enjoyed this video, please like it and subscribe to my channel, and I'll post again in a while. Thanks for listening.